Hello everybody, my name is Monita Sharma. Welcome to a brand new show, DIY Generation. Today I am sitting with Mr. Gurtej Singh. He is a very renowned personality of Punjab, the owner and chairman of IV chain of hospitals, I must say. Hello sir, welcome to India Today's new show.
Thank you, Monica. It's kind of you to say that I'm a renowned personality. I feel very blessed to be a part of this show. Thank you very much.
Sir, I was reading about you. Before interviewing you, I was just, checking out your background. And I was startled to know that you're a mechanical engineer. Am I right?
Yes, you're right.
So how did a mechanical engineer decide to enter a field of healthcare and became so successful?
So, Monita, you are right. I am a mechanical engineer by training and by my education. But I think I'm an entrepreneur by birth. I have always been very creative. I have been very enterprising in my approach towards life. A big turning point came into my life when I married a doctor.
All right.
So she was the inspiration, and she was a very, very dedicated doctor. She decided to pursue her MD in radio diagnosis after marriage.
Okay.
So she went to PGI, which is one of the most prestigious medical institutions of the country. So I think I draw my inspiration from my wife, Kaval.
All right. So, was there anybody else in your family who was into business, or are you the first generation businessman?
No, Monita, I am the first generation entrepreneur in my family.
Okay.
So most of the family members, they were in service. My dad, he was an advocate, and my mother, she was in the education department. So I think being very enterprising, I always wanted to do something meaningful in life. So after my engineering, I set up a manufacturing unit, and the reason was that I didn't want to do a mundane job. I didn't want to put myself into a 9-to-5 kind of a regime, and that's how I believe my journey brought me to setting up a chain of super specialty hospitals in North India.
All right. So, sir, when somebody is on the path of chasing one's dreams, one is bound to come across several hurdles also on the way. So, tell me something about your struggle. How were the initial days, especially since you were the first one in your family to start a business?
See, the biggest hurdle was trying to convince everybody around me. When I tried to consult my cousins, my elders in the family, I mean, they somehow felt that hospital industry was very demanding. It was perhaps a very, very challenging industry at that time also. It has become even more challenging as we have seen its growth. It was difficult for me to convince the Punjab government also, because this land was allotted to us in 2005, 2006. So initially we had to do a lot more than it would take now to convince the officers, the bureaucracy, that we were serious about our plans and that we could set up this kind of venture. And also I feel very blessed to be chosen by the Almighty. I have a die-hard fatalistic approach towards life.
Okay.
So corporatization in healthcare began in South India in the late 70s or early 80s. But in North India, we saw this corporatization just 15 years back or something. So I think I was there at the right time, at the right place. So things started falling in place, and that's how we could see IV emerge as one of the very credible medical institutions in the state today.
How do you ensure that that the patient gets affordable treatment, and that too quality treatment, no compromise on quality?
Yeah. Almost all of our hospitals, they are NABH accredited.
Yeah.
So NABH accreditation brings by choice a commitment to patient care.
Yes.
So NABH is the highest quality accreditation agency in the country today. So we made sure that when a hospital is commissioned, we immediately apply for accreditation. So we train our team, the nursing, the doctors, the housekeeping, everybody has to think that they have a responsibility towards the patients. So we invest a lot in training people because our commitment to patients comes by the NABH charter.
Okay, so you mean to say that there is some protocol that has to be followed?
Very rigorous protocols have to be maintained.
Okay.
Each department. So much so that even a nurse has to record how many pricks she made to draw blood from a patient.
Okay.
So at the end of the month, we see what is the variance. So if 2 pricks were allowed and she has used 3, so we have to go extra steps to train her, because we cannot compromise on the patient health and safety.
Yeah. And so in this time of cutthroat competition, especially as far as hospitals, in Punjab, they are opening one after the other every day. So how do you make sure that, your hospital remains one of the best choices, one of the most preferred choices for every patient in Punjab?
That is the most difficult part. I think we have to create a balance which is not easy to bring about. While on one hand we have to maintain the quality standards which have been put in place by NABH and by our own charter also.
Yeah.
At the same time, we have to be seen as the most affordable hospital. You might have read in the last couple of months, we have tried to follow the government initiatives of making healthcare delivery much more affordable. Most of the surgical procedures we do today are at government rates. So government rates actually brings a discipline on us. So if a private hospital, if a private corporate hospital is charging say 80,000 rupees for a normal delivery, we would be doing it at 35,000 rupees.
Okay.
So that brings us much closer to the population which is in the middle class or the lower and upper middle class segment. So we are not trying to cater to the ultra high rich population.
So another thing that I was curious about was that you are not a doctor yourself. So how are you able to understand the nitty-gritties of this profession?
I think it makes it easier for a non-doctor to understand these things because I am very detached to this. I will take, as I said, I will take a call which is right in the interest of the patients and in the interest of the institution. Often a doctor, when he is treating a patient, he becomes emotionally involved also. He doesn't want his patient to go anywhere. We have a very, very clear message to all doctors: if there is anything we cannot do for the patient, they must refer him out. We will not simply hold on to him just because he's giving us some money. No, that is sinful. That is a moral crime also in my knowledge.
So do you think that treatment in Punjab is now at par with treatment given in metropolitan cities, Bombay, Delhi?
See,
or do we still have a long way to go?
It's a very, very, very valid question, Monita. The answer to this question is not simple. See, IV has not set up quaternary care or high-end tertiary care facilities. If I talk only about IV, we are high-end secondary care provider. The metros of the country, they are able to invest much bigger amounts to cater to a different niche of patients.
Okay.
So we will be able to do organ transplant, we will be able to do joint replacements, we will be able to do cardiac surgeries, we will be able to do complex neurosurgeries and other laparoscopic procedures also. But there will be say 2 to 5% highly skilled surgeries which we are not equipped to do. At least I can say with the utmost humility that IV is not equipped to do it. But we are there in tier 3 towns where no other corporate hospital wants to go. We have tried to carry super specialty healthcare to the doorstep of patients in tier 3 towns. Nobody was there, and we don't expect anybody to come there also, because it is very difficult to create that balance between affordability and quality processes. So I don't want to name any other corporate hospital, but I know IV is there and IV has been able to perfect that model.
So, sir, how do you make sure that your doctors remain updated with all the latest advancements happening, all over the world regarding various treatments?
Yeah. So they are free to participate in conferences. We encourage them.
Okay.
So they definitely participate in conferences, and we organize our own CMEs.
Okay.
So it is a continuous medical education. So we bring speakers from outside. So they educate our doctors. So across the facilities also, so if there is a senior surgeon here, he's doing some cutting edge work, we are going to take him to our other facilities in Amritsar, in Hoshiarpur, in Nawashahar. We are going to educate our doctors also.
So, sir, finally, as far as the professional questions are concerned, my last question is that why should a patient come to IV hospital? What are the 3 things that you're proud of that happen only in IV hospital and they won't be able to find it anywhere?
I will not say I am proud of something. I always say that I am blessed to be a part of this story.
Right.
And the reason why a patient should come to us is because we are credible. We bring a level of transparency and code of ethical conduct which is not so strongly subscribed to by many hospitals. I'm not saying I'm the only one, but when it comes to a balance between affordability and transparency in conduct, I think IV would score a very, very high. Recently there was a very, very reputed magazine which carried a story which was based on a survey, a Nielsen survey. Okay, just few weeks back, maybe 2 months back it was published. IV has been adjudged as the best private hospital in Tri-City. Again, both of them are very credible organizations. So if they have on their own held that IV is the best private hospital in the Tri-City, I think we feel very blessed to be part of this. And the reason is because our team has not been under pressure to perform certain number of procedures as a part of their salary. We don't tell our doctors कि यार इतने आप surgeries करोगे.
टेस्ट लिख देते हैं डॉक्टर, टेस्ट पे टेस्ट.
Test, Monita, again you have to be very objective. You cannot generalize. If a patient comes to us and we are not able to thoroughly work him up, the treatment is going to be based on what diagnosis he makes. So एक हवा बन चुका है कि डॉक्टर के पास जाओगे आप 10,000 के टेस्ट लिखेगा 5,000 के. But imagine if you bring your loved one, we don't run the test and we put him on a wrong treatment. God forbid you lose the patient or some irreparable damage is done. You will never forgive us.
Yes.
So it is in the interest of the patient. Yes, there may be cases where 10 patients turn out to be normal. So we are happy. You are happy. There is no abnormality. But if we don't run him through the tests, just imagine the risk we are running, and there can be some time bombs in the body. Some diseases they are on a very, very short time frame. So if you don't treat on time, I think early diagnosis is what this medical treatment is all about.
So coming to the lighter side of life, tell me something about your family, your parents. Where do you come from? Are you originally from Chandigarh, Mohali region? Or?
No, I was born and raised in Ambala.
Okay.
So 1980 I shifted to Chandigarh. Then I went to Thapar Engineering College to do my mechanical engineering. So I've tried to do everything very fast in life. I got married at a very young age of 24 years.
Okay.
So became a father at 25. Father second time at the age of 27 and a half. So I think IV also happened very rapidly, and in the last 5 years we have rolled out one facility every year, and I feel very blessed. God has chosen to make us part of this beautiful environment, and we have a 2,000 plus family now. IV family is 2,000 strong now.
So you're a very busy man.
No, I'm not busy at all. I think I have been able to keep myself relatively free by delegating everything. We have a very corporatized structure. There is a chief operating officer, there is a chief financial officer. So every facility has its own general managers. So I don't think I like talking to
interacting with people.
Yeah, learning. I mean, so that's something which I like to do. And
what are your other hobbies besides interacting with people?
I like to travel. I like to play golf. I like good food. I'm a family person. I like to spend a lot of time with my family. I have some beautiful friends. I love to hang out with them.
What are the names of your children?
My daughter is Gurtej Singh,
Okay.
and she's again a radiologist like her mother. So she was recently conferred the gold medal for being the university topper. She topped the Department of Clinical Sciences in Bombay. So my son, he's Kanak Mahip Singh. He's the younger sibling. He's 24. My daughter is about 27. So son is a non-medico. He's a computer science graduate, and both of them are now helping us in business.
Great. And sir, finally, your mantra of success.
I think it is faith that keeps me sane, faith that keeps me happy, faith that keeps me reassured, faith that keeps me fearless, faith that keeps me grounded. It doesn't let me think that it is I who has done anything, and that is something I live by, and that is something which I feel is reverberating in my every cell in the body, and I want to just be in a state of gratitude. God has been very kind. I just want to be able to thank Him enough by way of doing good deeds, and that is the reason I don't want to shortchange any patients also.
Can you tell us something about your charity initiatives?
A lot of them. So as I said, so if there is a trauma patient coming to any of our facilities,
Okay.
so we are
Is there
not
anything for underprivileged patients?
only in Mohali. We do that
Okay.
only in Mohali. So, but that's a very small amount. We have 5% and we have displayed it in our front office. We have put it on our website also. So any patient coming who cannot afford, so there is a subsidized treatment. We have our own trust which sponsors such
Okay.
treatment.
Okay.
And but as it is, we are trying to provide services at very affordable rates. So at government rate, most of the services are at CGHS or Government of India rates.
Any other expansion plans?
Yeah, we are in a dynamic state. So I think once we are able to optimize our current capacities, definitely but we want to be a very focused regional play. We don't have ambitions to go pan country. So we'll be north of Delhi region, so Himachal, Haryana, maybe J&K.
Right.
So this region.
Fine. Thank you so much, sir. Pleasure.
Thank you very
talking
much.
to you.
Thank you very much, Monita, and God bless you.
Thank you, sir.